The Minister of Health, the Republic of Liberia, Dr. Louis Poto, just organized the first National Health Summit. It was held last week at the Farmington Hotel in Mangibi County. There was a 3-day summit. And in that summit, we had over 250 participants, all from the 15 counties of Liberia. We had all the 15 county superintendents being represented at that summit. We have various stakeholders. We have the civil societies group, other organizations, and even the private sectors were even involved in that summit. And the summit were all about reducing maternal and newborn death, because no woman should die while giving birth or even pregnant, and no baby should die, because they are our future leader. So the entire summit was geared towards reducing maternal and newborn death. So during the 3 days deliberation, we had presentations from the various counties. All the 15 counties presented on the service delivery, the infrastructures, the HR, and what have you. And among the 15 counties, BOMI came number 1. There were 3 counties that were recognized, that were appreciated for the hard work done. Over the past 1 year. You know, this government has gone 1 year now, so it was like evaluating what you have done within their 1 year when it comes to health. So it was 3 counties that stood up among the 15 counties, and BOMI County came number 1. It was BOMI, it was Bassa, and Nima. So we are happy, because one thing I told the summit participants was that we have a very supportive superintendent. The superintendent office has been very, very supportive to the county health. In fact, the superintendent is the chair of the health board. She chaired the health board. And since I got into this seat as the county health officer for BOMI County, my interaction with the superintendent has been very cordial. She served as a mother and as a support arm to the county health team and to the hospital. Through her office, the superintendent office, she has even made available a portable mobile X-ray machine that will be used in the hospital. We know how X-ray machine is very important. That can even help the doctor to diagnose cases for patients, which we soon is in process. We are procuring it. She has already made the money available. So the supplier will soon be delivering that portable mobile X-ray machine to the Liberia Government Hospital to be used for the people of BOMI County. Well, I can state the figure right now, but it's a good amount. It's a good amount. But she knows the importance of health, what health means. So I don't care how much it costs, it doesn't matter to her. It's just that she wants the people of BOMI County to be healthy. I think that is her goal. And then she also made available, I think just recently we had this outbreak at the precinct compound, where we had a scabies outbreak at the precinct compound. And the health team went there and they gave some medication. They fumigated the precinct compound. They also gave some cleaning materials and things to the precinct compound. We have been having a series of meetings about the well-being of the inmates at the precinct compound. So the superintendent thought it was through her office to also make some drugs available for the prisoners. That has already been procured. And even when she traveled just recently, she brought some medical supplies for the counties. So she has been very supportive. Our board meeting, she chaired what the board. To the summit, she was so impressed, because the summit was an eye-opener for most of our superintendents, to tell them, to remind them of the roles and responsibility as superintendent in the county. Because you as a superintendent, you're supposed to be calling like the coordination meeting, where all land ministry come to discuss issues. Yeah, it can be health. It should be health in that meeting, agriculture, education, gender, information, all coming together, under one umbrella of the superintendent to discuss. Yeah, so it was a really eye-opener there, and we won the first place trophy for BOMI. And after we got this trophy, we took photos and sent it in the chat room, because the trophy was not only for the CHO and the superintendent, but for the entire BOMI County, because the OICs, the staff, the nurses, the midwives, the PAs, even the cleaners, the drivers, they are all working. So we all have won. It's not only the superintendent and the CHO. Thank you very much. So for ambulance, the entire county, we have 3 ambulances, right? So 2 is stationed at the hospital here, right? Because we always have referral at the hospital. And 1 is stationed at Swan Mecca, because why we carried there was to reduce the referral time. Because if the ambulance has to drive from here all the way to go to for patient, all the way as far as Baklatan, the distance before the patient come back, and it will be a problem. So that ambulance has been stationed, one of the 3 ambulances, one of them has been stationed to Swan Mecca district, that will refer patients from all over from that belt to bring them to the Liberia Government Hospital to shorten the referral time. So as I said, we are all fighting again. And mainly the referral are pregnant women. Yes, so we want to shorten the referral time. So when it comes to drugs, yes, the Ministry of Health, our minister is ready. When they say hands on, we have even gotten our first quarter drugs. Yes, first quarter, when we say first quarter, that is January, February, March. And that has been distributed to the various facilities and the hospital. So we are good on drugs. Okay. We are good on drugs and medical supply, even though for now we don't have our maternity ward, because we have the first lady. The first lady project is ongoing at the hospital there. So we hope pretty soon it will soon be turned over. So in that first lady project, we'll be having the NICU area, and we'll be having the place for the women, the pregnant women. Yes. So we need incubators, we need phototherapy lights, but the ministers and the first lady are working hard to equip that maternal and neonatal unit when it's fully completed. So we are good on drugs. What we are trying to do now, in the past times, we have been having free services, right? People are used to free services, come to the hospital, but it actually hasn't been working. Because when people come, no drugs. You come, for instance, you come and sit down for 2-3 hours to see the doctor. When you finish seeing the doctor, then they give you paper to go and buy the drugs, at the pharmacy or the drugstore. So it deters people from coming to the facility. So they say, well, then why I can just go to the drugstore and buy my medicine? As I mentioned, but not knowing at the drugstore, most of the drugstore do not have the right temperature for the medicine. So some of the medicines, they are expired. And you see, time in time, people will be treating malaria for 2-3 weeks, which is malaria should be treated for 3 days. You see somebody taking malaria medicine for 2 weeks, they can't get well because the drugs, they are expired. So what we are trying to do, the Minister of Health has already launched the drug revolving fund. We know in time past, the US government was supporting, right? But when Donald Trump came on board, he said, American money for America, for Americans. So all those free things then we were getting, they cut it off. So how do we continue to run our health system? How do we continue to maintain drugs in a facility, in a hospital and a clinics? So we have to do the drug revolving fund. Drug revolving fund is not for profit. It's just to ensure that we always have drugs. So patient will be paid small amount. Say for instance, paracetamol in a drugstore is $50. In a hospital or the clinic, it will be less than $50, right? Amoxicillin in a drugstore is $150. In a hospital and a facility, it will be less than $150. It is just there to ensure that drug is always available in a facility, so that people will not be going, they sit down for long hours, they don't get medication, they go to the drugstore, buy expired drug, and they continue to get sick and sick and sick. So that is the intent of the drug revolving fund. So that is the new strategy on board, and all the 15 counties are going to be doing the drug revolving fund. Yeah, and I also said that BOMI County will also put in a strategy, because we saw that during the visiting hours, we see that over 5 visitors coming to one patient at a time, which is overcrowding, the hospital, some of them sitting on a patient bed, and we have this sickness they don't know. Sometimes you even tell them, get on the patient bed, they feel offended. But they do not know that you can even get sickness from the hospital, which is called nosocomial infection, hospital-acquired, sickness. You see, as a visitor, you're not supposed to sit on a patient bed. So we are trying to reduce or curtail that. So what we have brought in place is this: one patient, one visitor at a time. One patient, one caretaker at a time. So we are going to launch that initiative tomorrow. Yes, and our security is going to take full charge to ensure that we have some regulation in the hospital. Another thing that we have been struggling with is this, plastic bed, the water plastic. Most time the patient, we know times are difficult. We are not telling them to go and buy mineral water. We know one bottle, a small bottle of mineral water is $50, right? Compared to you going and buy your plastic water, like 10 plastic right there. So we tell you, buy your plastic water, just put it in the bottle. Because when they bring the plastic in the hospital, they drop it all over. Some of them, that plastic water, when they drink it, they won't finish it, right? They will put it on the bed, and it will leak all on the bed, and wet the linen, the bedding, dirty the floor, and everything. So we are trying to curtail that. We are not saying that our patients should go and buy mineral water. No, we know times are hard. It's just that we are encouraging them to help to keep the place clean and for their own health. Then they buy their water, they empty it in the bottle, and they come with it to the hospital. So that is going to be put in place, and we have already started that. Even with our security, I think before then you saw our security just passing in ordinary clothes, not being identified. Sometimes the caretaker or the patient would just lash at them, say anything to them because they are not being identified as security. So what we did, we uniform our security. Our 20 security now, they have the uniform, they have the baton and the flashlight. So if you see our security now, nobody have to ask you to say, who are you? You know straight they are security. So we are working so hard. When I got on board, we even tried to get some office supply. I think you can see the CHO office. You can see how it's different. It's not only the CHO office. Go to the other offices. We bought 4 brand new air conditioners. We also bought 5 brand new laptops with printers. Yeah. And to enhance the work, we made cleaning materials available. We made stationaries available for the facilities. And we have 30 facilities now in BOMI County, including the government hospital. 30 facilities. So we are all working collaboratively to ensure that we continue to provide quality health care services for the people of BOMI County.
Thank you very much.